Hello everyone, I'm Dr. Liu. I'm from the first affiliate hospital of China Medical University. Today, we will learn the manipulating techniques with filiform needle. In this chapter, there are 11 parts. First, structure, specification, examination of filiform needle. Second, needling practice. Third, selection of filiform needle and sterilization. Fourth, posture of the patient. Fifth, manipulations of inserting needle. Sixth, manipulations of needling techniques. Seventh, getting chi. Eighth, reinforcing and reducing methods. Ninth, retaining and withdrawing the needle. 10th, prevention and management of possible accident. 11th, precautions in acupuncture treatment. In this class, we will learn the first 4 parts. Needling techniques, 针刺 called in the ancient time, is developed from the treatment of disease by针stones. Needling technique recently had an extensive sense, which means the methods of protecting and treating disease through stimulating certain parts of human body by means of different kinds of needles or non-needle methods with certain manipulation techniques. Section 1. Structure, specification, and examination of filiform needle. There are many materials for acupuncture needles in clinical use, such as stainless steel, golden and silver, common steel, copper and iron. But the stainless steel needle is the most commonly used in clinic because it is easy to keep in straight and smooth surface, resistance of high temperature, rust prevention, and not easily destroyed by chemical substance. A filiform needle may be divided into 5 parts: the tip, the body, the root, the handle, and the tail. The tip of needle is the sharp point of the needle, which is the key point of the needle for puncturing. The body is the part between the handle and the tip. The root is the demarcation line between the body and the handle. The handle is the part webbed with filigree either of copper or stainless steel, which is the place where the practitioner holds or manipulates the needle or warms needle with moxa. The tail is the part at the end of the handle. The filiform needles vary in length and diameter. Needles from numbers 29 to 34 correspond to 0.24 to 0.34 millimeter in diameter, and 1 to 3 chun correspond to 25 to 75 millimeter in length, are most frequently used in clinic. Thinner needle is now strongly recommended to be used for avoiding needling pain. Short filiform needles are mainly applied for shallow puncturing on ear point or shallow body point, while long filiform needles for deep puncturing on the point with which muscles or for penetrating puncturing from point to point. Before the use of filiform needle, it should be examined carefully in order to avoid accident or affecting the therapeutic result. A good filiform needle should shallow as follows: the needle tip being as sharp as pine needle, the body being round and smooth, flexible and resilient, the root being firm without eroded. Attention should be much paid in examining the used filiform needle. Section 2. Needling practice. Needling practice mainly refers to training the finger force and manipulating techniques. The finger force means the strength exerted by the practitioner's fingers during puncturing. Well-trained finger force is the basic of needling techniques, where the skillful needling techniques are the precondition of therapeutic effect. Practice for finger force. The finger force is often practiced in soft paper packet. Fold fine and soft tissue into a small packet about 5 cm multiply 8 cm in size and 2 to 3 cm in thickness. Then bend the packet with gauze thread. Hold the paper packet in the left hand and the needle handle in the right hand. Insert the needle into the packet and rotate it in and out, clockwise and counterclockwise. Repeat the practice until you feel it is easy to do. Practice for needling techniques. Needling techniques should be trained in a cotton cushion. Make a cotton cushion of about 6 to 7 cm in diameter, wrapped in gauze. During the practice, practitioners must equably do these techniques with an appropriate depth and straight needle body. The practice should be repeated until all techniques are well trained. Then the manipulation of combining lifting, thrusting, and rotating can be practiced. Practice on our body. After strong finger force and skillful needling techniques are made through the practice on the paper packet and the cotton cushion, the practitioners can practice on their bodies so as to get the personal experience of the needling sensation and the relationships between finger force and insertion of needle, getting chi and needling techniques, and the different sensation of puncturing hand and punctured point. Treatment cannot be conducted on the patient unless you are able to insert the needle properly and skillfully. Section 3. Selection of filiform needles and sterilization. Selection of filiform needle. The filiform needles made of stainless steel are commonly used in recent clinic. Before use, the filiform needles with appropriate length and size are selected based on the patient's different conditions, such as gender, age, slim or fat body, strong or weak constitution, deficiency or excesses of disease. Sterilization of filiform needle. The range of sterilization prior to treatment includes needles, practitioner's hands, and punctured skin. Disposable filiform needle is strongly recommended. Needle sterilization. There are 3 kinds, include autoclave sterilization, medicinal sterilization, and boiling sterilization. Practitioner's hand disinfection. Prior to treatment, the practitioner's hands should be disinfected routinely as following. Firstly, cleaned with the soap and then wiped by 75% alcohol cotton ball. Skin disinfection. The skin of to-be punctured point must be disinfected with 75% alcohol cotton ball, or first with 2.5% tincture iodine, then by a 75% alcohol cotton ball to remove the iodine. The skin disinfection should start from the center of point to be outside. Section 4. Posture of the patient. Generally, the proper posture of the patient should be convenient for correct location of the point, manipulation of needling, and comfortable to the patient for long retention of needle. The common postures in the practice are as follows. First, supine posture. The posture, also called back position, is suitable for the point on the head, face, chest, abdomen, and forelimbs. lateral recumbent. The posture of lateral recumbent is suitable for the point at the lateral side of the body and the forelimbs. Third, prone posture. The prone posture, also called stomach position, is suitable for the point on head, neck, upper back, lower back, buttocks, and the posterior aspect of lower limbs. Fourth, sitting on a lazy back, also called straight sitting with the back leaning against the chair. It is suitable for the point on head, face, neck, chest, and forelimbs. Fifth, sitting in flexion. The posture is suitable for the point on the head, neck, and back. Sixth, sitting in lateral flexion, also called sitting with one side of the head exposing the practitioner. It is suitable for the point on the vertex, the temple, the auricular place, and the cheek. Okay, this class is over. Thank you for listening. See you next time.